I didn't come to a conference with a room full of economists expecting to hear the words narrative and problematique. So thank you, Greg. I feel quite at home now. Now, I know that Bob Evans likes to start things with a literary reference, so I'm happy to say that when I gave a colleague a draft of my paper some time ago, he said that it put him in mind of Voltaire's Candide. And of course, Candide is a satire on unbridled optimism, where you have one particular character saying things like, all is for the best in the best of all possible worlds, and meanwhile, all hell is breaking loose. So again, you have to recognize that the narrative of Candide is full of beatings and battles and syphilis and drownings and disembowelings and theft and hangings, torture, earthquakes, tsunamis, forced prostitution, and yes, even monkey attacks, all of which together, some would say, is probably an apt enough metaphor for federal-provincial relations. So you may say, well, why the optimism? How justified or unjustified is it? Well, in the first place, if you came here looking for pessimism, I know that you will be talking about the Atlantic provinces soon enough, and you'll have enough pessimism there to fill your boots. But I also want to say that it's very important not to let politics too far out of the scope of investigation of the issue here. The institutional context really matters. It matters in explaining why we have the problems that we have, and it also matters in terms of thinking what it is we can do about what the problems are. And the institutional context, as you know, is highly political. So political scientists have a very prosaic way of talking about change. We have something called the theory of path dependency, in which systems sort of settle into a kind of homeostasis, where it's really hard to budge anything off the course that it really enjoys. But occasionally, in fact, there are critical junctures which tend to destabilize the normal way that things work, and the possibility of implementing new ways of doing things really does arise. And I think that December 2011 is as good a critical juncture as any. Of course, you had the meeting of finance ministers in which the bomb was dropped, and you had the finance minister essentially saying, well, that's that. And then you had, so I think it was Graham Steele asking, well, where are things, how do things go from here? And the response simply was, well, that's it, folks. And in retrospect, I think you could say that things had been moving in this direction for some time, but it had certainly not been the expected outcome. Things ended with a bang, in fact, but also a great deal of whimpering. So the question really is, well, okay, so there's a critical juncture here, fine, but where and what form will the change take? There's certainly, especially in the media, but also in academics, there's been a lot of hand-wringing on the capacity of Canada's public healthcare system to survive as a national system, and especially as a public healthcare system in the face of all that. And this, in fact, may well be the case. But there has been a lot less discussion of what, again, political scientists call the transformational potential of what we now have due to there being this kind of critical juncture. Now, I should say that for those of you who are hoping for radical change, it probably won't happen. The Canadian healthcare system, for better or for worse, really is a big lump, and it's very difficult to change it either in one direction or another. So regardless of what happens, we probably won't be going to hell in a handbasket, but at the same time, if you're looking for, quick and radical change, that's probably not going to happen either. And if there are people here from Britain, you'd say as well, that's probably a good thing. Too much change in healthcare system isn't healthy. So what I want to do is to follow on from a couple of threads that Monsieur Foret had in his paper and just develop them a little bit more. And the first one, I don't think it came out in his discussion, but I picked it up immediately in his paper, where he says that he makes the observation, what makes the current circumstances particularly unsatisfying is the lack of a debate on the motives behind Ottawa's decision and a clear sense of where it intends to go next. Now, you know, I think you can pick the political scientists out of the audience here because well, in the first place, we don't have any charts or graphs, and I apologize for that. But at the same time, we do look for political motives. Why did they do that? What's happening here? And I also want to pick up on his prediction that the healthcare system will become more rigid because of its declining capacity for common problem solving. And in fact, this may be the case. In fact, it might be that's where the smart money is. But I just want to push that a little bit more. Okay. So what's the comparative empirical evidence on the relationship between federalism and cost containment per se? And the answer is, well, it's just pretty inconclusive, like a lot of academic empirical work. The more interesting question here has really become, in what ways can federal systems be restructured or recalibrated in order to have a real impact on public spending? And there has been a lot more academic work on this. There's three approaches. I originally had called them three models, but then I was cautioned. Remember, you are dealing with a room full of economists, and they have a particular way of understanding models, and they may ask you for, you know, equations and whatnot. So if anybody has any questions about the more, you know, econometric or technical aspect of some of this stuff, actually, just ask John. You're a real economist, aren't you? Yeah, there you go. Okay. But I can't help you. So the first approach, which is not a model, is simply that which we've had, which I would call the recent orthodoxy on conditional federal spending. And the claim here, the relationship between federalism and cost containment, is that overarching structural and program changes are most effectively and perhaps can only be achieved with the leadership of the federal government, specifically using its spending power as a means of securing compliance. Now, some might say, well, that's pretty rich, right, given that it was the federal government utilizing its spending power, which really caused this huge expansion in healthcare spending to begin with. But I think, nonetheless, it does follow that if we want change, it is Ottawa using the stick as well as the carrot that will push us in this direction. So a lot of people are saying, well, we don't have this, essentially we don't have this more. We've got federal spending, but it's not conditional, right? And there are others who would critique the model of conditional federal spending, saying that we don't really want conditional federal spending because it doesn't work for a number of reasons. The first one, I think there's been a paper by the economist at Calgary, Ronald Kneebone, who's done an analysis of moral hazard in federal systems, where essentially what he argues is that taxpayers experience what he calls fiscal illusion because of the gap between expenditure covered by provincial taxes and that covered by intergovernmental transfers. So because transfers are coming in, provinces think they actually have more money than they really do, and they're willing to spend more. I'm a little bit skeptical about that, even though it's somewhat rich not being an economist, but I'm not sure how strong a cost driver moral hazard is compared to other cost drivers. I think it's also possible to find opposing empirical evidence which says just the opposite, that, again, moral hazard doesn't exist in Switzerland. I think there's a case study on that. And I think you also have to bring in the normative discussion here, which is that, well, maybe, if in fact this is true, maybe some provinces actually have a right to make demands beyond their capacity. I mean, this is the principle underlying section, 36(2) of the Canadian Constitution, right? That's one of the ideas behind equalization. Anyway, so there are other criticisms of the federal conditional spending model or approach. One, of course, these are much more familiar. Distortion of priorities, jurisdictional overlap, and again, there's lots of literature on this. But there is, so the whole idea of conditional federal spending is really becoming much more irrelevant simply because there is very little conditional federal spending. There's a different kind of approach, which I think is becoming much more prevalent, and there has been very surprisingly little discussion on. And this is, again, getting back to the question of motive. Why the heck did Ottawa do what it did, take the position that it did so clearly, so cleanly, and so strategically? And some would say, well, it's just open federalism. The Feds have been talking about open federalism for a while. I don't think it's open federalism. Open federalism, again, is the claim that we have to respect the jurisdictional capacity of each level of government. So Ottawa has been saying, in terms of social programs, yes, the provinces really have to look after this. It's none of our business. However, in other areas, areas of the economic union, for example, it's true that Ottawa has been much more willing to step on the toes of the provinces. The National Securities Regulator comes to mind. And I challenge anybody in this room to say the words open federalism and insight in the same sentence. So there are a lot of examples where open federalism, please. I don't think that's what's going on. So academics, again, looking at this question in a little bit more depth, have come up with a theory of market-preserving federalism. And this was originated by, in fact, a political scientist at Stanford University, a guy called Barry Weingast, who's been writing about this for a decade now. And he calls this market-preserving federalism. And the theory was originally developed for developing countries such as India and China. And the question was, well, how can federalism be recalibrated, restructured in order to promote economic growth? And the answer was, well, we do it by minimizing public spending. How do you minimize public spending? Well, essentially, you make the jurisdictions compete between each other. So here are the conditions of market-preserving federalism. The first two are, if you remember William Riker's work on federalism, this is essentially his definition of what a federal state really is. You start with a clear federal structure in which subnational governments are responsible for their economies, and you have a national government responsible for essentially the economic union. But then what you do is you impose what Weingast calls hard constraints upon subnational units, i.e. provinces, so that they have to compete, right? So that if they are facing capital flight, if they have to attract businesses, then they will work a lot harder to bring taxes down, and again, they don't want to have a lot of deficit, so they will be on their best behavior. And the last point that I can't talk more about, though I wish I could, is to make the change as permanent as possible so subsequent governments can't undo your work, which, again, I think is quite alarming. There are a number of criticisms of this approach. There's been some discussion, well, is it really applicable? To what extent does it depend upon the conditions actually working? And I know that the conditions in Canada are not perfect. We certainly don't have a watertight, compartmentalized form of federalism. A more important criticism, I think, though, is that however much it's attractive in some instances, market-preserving federalism really doesn't work that well in healthcare. And again, this is something that's been said ad nauseum. I think Ken Arrow, in one of his papers that was published the year I was born, was writing about this. Healthcare is not a consumer good like any other consumer good. And to the extent that you're going to have more competition for healthcare resources, I think it's pretty easy to see how this can potentially drive up the costs of healthcare. I mean, it's bad enough that we already compete for physicians and for nurses. You know, we want to increase that competition. So even though I suspect that the motive here by Ottawa probably is influenced by the theory of market-preserving federalism, it really has not been thought through what the consequences for healthcare are going to be. And I should say, I have no proof. However, market-preserving federalism really comes out of the School of Economics. I'm sure most of you know the Virginia School, which is a particular angle that has been of some interest to the University of Calgary School of Economics, which has produced the current Prime Minister. So I won't draw any other parallels, but let me tell you, if it walks like a duck and it quacks like a duck, it's not going to be rutabaga. Okay, so this is something that may occur. I think there is a motive for that. Are we going down this track? Well, the interesting thing, is that something very interesting happened in January. And this is, rather than responding competitively, provinces responded in terms of increasing cooperation. And this is the idea of decentralized cooperation. And the claim here is actually highly intuitive, sorry, counterintuitive, and it goes against everything that John was talking about. So unlike the previous two approaches, which essentially utilize strict methods of accountability, or if you want this, then you have to do, you know, the Ottawa will say, if you want this, then you have to follow along according to these rules. Market-preserving federalism says, you know, there are hard constraints. The economy will, or the market is going to react a certain way if you don't behave yourself. This particular approach gets rid of the hard constraints and holds that a softer and more diffuse manifestation of accountability can, in fact, produce more significant results in cost containment over time. And again, there has been a lot of theoretical literature talking about the problems with voluntary cooperative approaches with no clear co-decision processes. Again, the most famous is Fritz Scharf talking about the joint decision trap, in which if nobody has to agree, then you just get down to the lowest common denominator. So the problem in Canada, again, is seen as this. If Ottawa steps off the stage, provinces will just bicker and posture while the system collapses. And as Monsieur Frey has said, that provincial programs will grow apart with gradually fewer opportunities for sharing and learning. And again, that's quite possible. However, again, something very interesting happened in January 2002. There was a move toward greater cooperation on the part of a number of the premiers. And he actually said that. I won't get into that. The idea is that voluntary cooperation can, in fact, be quite constructive. And there's a lot of literature within Europe about how this works. There's principles under which why participants would, in fact, engage voluntarily. It contrasts to old systems. It's soft governance as opposed to hard governance. But the idea here is you don't need one government treating the other governments as recalcitrant schoolboys, thinking that they won't do something unless you can threaten them with a paddle. Now, there's also a lot of literature talking about the context within which this approach can work. And if you read through it, I'm not going to list them, but if you read through them, this sounds exactly what Canadian healthcare now is facing. So I won't get into that. But in conclusion, I think that we have to look at the motives behind what's happening. I think that we have to really worry about what's going to be happening in the future, especially with Quebec. I believe that Ottawa is going to have even more of a hands-off approach. It's going to try to wrest the honeypot away from Quebec, and that means it really won't want to get involved in social policy any more than it has. So, in conclusion, here we are, just Dr. Pangloss and myself, and the question is, are we being foolishly optimistic? There's certainly no guarantees that this approach will work, at least as effective as is necessary for it to work in order for us to preserve a sustainable public health care system. Of course, this brings to mind Robert Oppenheimer's quip that the optimist thinks this is the best of all possible worlds, but the pessimist fears that it is true. Perhaps the best response to this charge of Panglossian optimism is that offered, in fact, by Candide himself, who simply replied that all we really can do, and possibly hope to do, is to cultivate our garden the best we can. Thank you.